Hi, I'm Dr. Steve Myers, and I'm here with my patient Joan, who is 1 year out from bilateral knee stem cell. Before we talk to her, we're going to take a quick look at her x-rays and see what we were dealing with at the beginning. Okay, so taking a look at her knees, this is her left knee, and here is her right knee. And if we zoom in on this right knee, you can see good amount of joint space. This is the cartilage thickness in the joint. She should have the same amount of cartilage thickness or dark space on the inside. This loss of dark space is loss of cartilage. We call that arthritis. She also has a big bone spur on the inside and a bone spur on the outside of the knee. Those are arthritic changes. Looking at the left knee, again, good joint space on the outside of the knee, but significant loss of space on the inside. Almost bone on bone, loss of joint space, loss of cartilage, and significant arthritis in the knee. So it's been a year since your treatment, correct?
About a year and a month.
Take me back to before your treatment. Describe your symptoms in the knees. What kind of issues were you having with the knees back a year ago before we got started with treatment?
Well, we had done some injections which had helped, but it stopped helping. And I was literally getting to the point where I could not walk. I couldn't hardly bend my knees. I couldn't hardly straighten them. I was using a cane and a walker most of the time. I was getting where I was just getting really reclusive because I didn't want to do anything because I hurt so bad.
And what kind of treatments did you have before we went to stem cell? What treatments did you have?
We, well, way back when I think we tried some physical therapy, and then we went to the injections. Mm-hmm. And we did about, I think I came back maybe 2-3 times over quite a period of time. It was doing pretty good for a while, and then the last time it just
didn't help anymore.
It didn't work.
Stopped working.
Right.
Take me back to the day of the procedure. How much pain was there getting the cells and doing the injections?
It wasn't bad at all. It was not. I was prepared, you know, because I figured it would be uncomfortable, which, you know, it was strange and it was a little bit uncomfortable, but as far as the pain, it was very minimal. Okay.
And then after the procedure, how quickly did you start seeing some benefit?
My right knee, one of the doctors that was there with you asked me to move my right knee. I actually got off the table and was able to swing my right knee. My left one took a little bit longer. It probably took me, I don't know, I can't remember when you had me come in for...
About a 1 month follow-up was your first visit.
Okay. Yeah, but about right then I was really doing pretty good, and then a couple of months after that I was doing better, and now I have no pain at all, unless I get tired, you know, but that's my age.
So zero pain.
Right.
And back to normal activities, not using a cane, not using a walker. Are you able to do stairs, go shopping?
Yes. Compared
to before we got started?
Yes.
50% better, 80% better, 90% better? Put a number on it.
300% better. I can't explain. I did not think I would be in this shape, this good. I knew I was going to get better, but I had no idea I was going to go back to just perfectly normal.
So 1 year out from procedure, do you feel like you made the right decision?
Yes. Yes. You gave me a choice. You said I could, if I wanted to try this, or you said the other alternative was knee replacement, and I was not on board with the knee replacement. I was ready to try this. I thought it was a good idea.
Well, I'm so glad to see you're doing so much better, and thanks for coming in and sharing your experience.
You bet. Thank you for helping me.